Today we are going to talk about 3 vitamins that you should take every day if you are over the age of 60, if you have weak legs, if you have knee pain, hip pain, or your legs feel tired all the time. Then definitely watch this video until the end. And also, do not forget to subscribe so you don't miss out any future videos. Let's begin. No 1. Calcium. Why? Well, our bones and teeth are made from minerals, right? And the most important mineral for our bones is calcium. So if you don't have enough calcium in your body, it will start taking calcium from your bones, making them soft and weak, or it will prevent you from absorbing enough vitamin D, which will lead to bone loss. In fact, according to the National Institute of Health, one of the most common nutrient deficiencies among older people is calcium. Studies show that only 30% of adults aged 50 years and older consume enough quantities of calcium on a daily basis. However, it's never too late to start. By improving your calcium intake now, you can reduce your risk of developing osteoporosis, which can cause painful fractures. The recommended dietary allowance for men under 70 years of age is 1,000 milligrams per day, while for women over 50 and men over 70, it is 1,200 milligrams per day. Good sources of calcium include dairy products such as milk and yogurt, but it can also be found in non-dairy products such as tofu, almonds, orange juice, and leafy green vegetables. It is important to point out that it is better to get calcium from food than to take it as a supplement. However, if that's not possible, then supplements can be very helpful. There are many different types of calcium supplements available, so it's important to choose the one that's right for you. Some common types of calcium supplements include calcium carbonate, calcium citrate, calcium gluconate, and calcium lactate. Each of these supplements has its own advantages and disadvantages, so it is important to speak with your doctor or a pharmacist to find out which one is right for you. Number 2. Vitamin D. According to Medical News Today, vitamin D plays a critical role in bone health. It helps the body absorb calcium, which is essential for strong bones. Unfortunately, as people age, their skin becomes less able to synthesize vitamin D when exposed to sunlight. Additionally, older adults may spend less time outdoors, which further reduces their vitamin D intake. As a result, many older adults are deficient in vitamin D, which can lead to bone loss and increased risk of fractures. Studies show that more than 40% of Americans between the ages of 65 and 75 have vitamin D deficiency, and up to 80% of those over the age of 85 have vitamin D deficiency. Moreover, it has been estimated that 50% of nursing home residents have vitamin D deficiency. That's why most doctors recommend taking a vitamin D supplement. According to the National Institutes of Health, most healthy people younger than 70 years of age who get some sunlight and eat a normal diet should be able to get all the vitamin D they need from their diet and exposure to sunlight. However, older adults and people who don't spend much time outside may need a supplement. For most people, 600 to 800 international units of vitamin D per day is sufficient. But it is important to note that the amount of vitamin D needed can vary depending on a number of factors, including a person's age, skin pigmentation, and sun exposure. And no. 3. Magnesium. Are you getting enough magnesium in your diet? Magnesium is one of the most important nutrients for our body, but most people don't get enough. A study published in the Journal of the American College of Nutrition found that only 15% of men and 24% of women consume enough magnesium. What's more, a study conducted by the National Health and Nutrition Examination survey found that about 68% of adults aged 20 and over had an inadequate magnesium intake. Older people are at a particularly high risk of magnesium deficiency Because the body's ability to absorb magnesium decreases with age, magnesium deficiency can cause muscle weakness and cramps, especially in the legs. It can also cause fatigue, insomnia, anxiety, high blood pressure, low testosterone, osteoporosis, and type 2 diabetes. Fortunately, there are many delicious foods that are high in magnesium, such as spinach, avocado, pumpkin seeds, chia seeds, cashews, whole wheat, and soy milk. But if you are not able to get enough magnesium from your diet, then you may want to consider taking a supplement. Magnesium supplements are generally safe for most people when taken in recommended doses. However, it's always best to speak with your healthcare provider before starting any new supplement, especially if you have any underlying health conditions or are taking medications. Now, let's take a look at how much magnesium do you need. According to the National Institutes of Health, the recommended dietary allowance for magnesium is 320 milligrams for women and 400 to 420 milligrams for men. However, it's important to note that these recommendations may vary depending on a person's age, sex, overall health, and other factors. If you are over 60 and have weak legs, then chances are you may be suffering from a condition called peripheral artery disease, which affects approximately 12 to 20% of people over 60, causes blockages in the arteries that supply blood to the limbs, resulting in symptoms such as cramping, numbness, or pain in the lower legs or feet when walking or exercising. This condition can be serious and lead to complications such as heart attack, stroke, or amputation. Fortunately, there are things you can do to improve your symptoms and reduce your risk of complications. First, you should make an appointment with your doctor and ask him to check your ankle brachial index, which is a simple test that measures the blood flow in your legs and feet. If your doctor finds that you have PAD, he may also perform a test called a lower extremity venous duplex ultrasound to check for blood clots in your leg veins. Although there is no cure for PAD, there are treatments available that can help alleviate symptoms and prevent complications. One treatment option is a type of physical therapy called graduated compression stockings, which involves wearing special socks that apply graduated levels of pressure to the legs to promote blood flow. Another treatment option is a surgical procedure called angio, which uses a catheter to open up blocked arteries and restore blood flow. If you've been diagnosed with PAD, important to follow your treatment plan closely and make lifestyle changes such as eating a healthy diet, exercising regularly, and quitting smoking to improve your overall health and reduce your risk of complications. It is also helpful to learn about PAD and how to manage its symptoms through resources such as the National Heart, Lung, and Blood Institute. By taking these steps, you can help keep your legs healthy and improve your quality of life. Thank you for watching, and please, before you go, don't forget to subscribe so you won't miss out any future videos. Also, you can leave your comment below and share this video with someone who needs it. Have a wonderful day. Bye.